Good morning, students. Today, we will embark on a comprehensive journey through the fascinating world of coarctation of the aorta. Coarctation of the aorta, also known as aortic narrowing, is a congenital heart defect characterized by a constriction in the aorta, the main blood vessel that carries oxygenated blood from the heart to the rest of the body. This condition affects approximately 1 in every 2,500 live births and can lead to significant cardiovascular complications if left untreated. Throughout this session, we will explore various aspects of coarctation of the aorta, including its developmental origins, pathophysiology, diagnostic imaging techniques, treatment options, long-term outcomes, and its associations with other cardiovascular conditions. By the end of this session, you will have a deep understanding of the complexities surrounding coarctation of the aorta and its management. Coarctation of the aorta arises during embryonic development due to abnormal growth and remodeling of the aortic arch. It is often associated with genetic abnormalities, such as chromosomal aberrations and mutations in various genes involved in cardiovascular development. We will delve into the molecular mechanisms underlying these genetic factors and their contribution to the formation of coarctation. The narrowing of the aorta in coarctation leads to increased pressure load on the left ventricle. This chronic pressure overload triggers a cascade of events that ultimately result in left ventricular hypertrophy, a condition characterized by an increase in the size and mass of the left ventricular muscle. We will explore the physiological adaptations and pathological consequences of left ventricular hypertrophy in coarctation patients. Accurate diagnosis of coarctation of the aorta is crucial for appropriate management. We will discuss the imaging modalities commonly employed for the diagnosis of coarctation, including echocardiography, magnetic resonance imaging, MRI, computed tomography, CT, angiography, and invasive angiography. Each technique has its advantages and limitations, and we will clarify the role of each modality in clinical practice. Balloon angioplasty and stenting have revolutionized the management of coarctation and provided less invasive alternatives to surgical repair. We will explore the principles behind these procedures, including patient selection criteria, technical aspects, potential complications, and long-term outcomes. Additionally, we will discuss the role of these interventions as primary therapy or as a bridge to surgical management in certain cases. In some instances, coarctation may recur after previous interventions, necessitating further surgical management. We will explore the challenges associated with recurrent coarctation and discuss the controversies surrounding the choice of surgical technique, timing of intervention, and the impact of repeat surgeries on long-term outcomes. Coarctation of the aorta has been associated with an increased risk of cerebral aneurysm formation. We will delve into the epidemiology, pathophysiology, and clinical consequences of coarctation-associated cerebral aneurysms. Furthermore, we will discuss the various management strategies available to mitigate the risk of rupture and optimize patient outcomes. Surgical repair of coarctation during infancy aims to relieve the aortic obstruction and restore normal blood flow. In this topic, we will examine the long-term cardiovascular outcomes, including the risk of late complications such as recoarctation, hypertension, and exercise intolerance. Furthermore, we will investigate the impact of coarctation repair on the quality of life and psychosocial well-being of these individuals as they transition into adulthood. Bicuspid aortic valve, BAV, is frequently encountered in patients with coarctation of the aorta and influences the management strategies employed. We will explore the anatomical and molecular associations between BAV and coarctation and discuss the implications for surgical repair. Understanding these connections is crucial for optimal decision-making regarding valvular repair or replacement, and also for the prevention and surveillance of associated complications such as aortic dissection. Assessment of functional capacity is essential for monitoring disease progression, guiding treatment decisions, and evaluating the efficacy of interventions. We will investigate the role of exercise testing in coarctation patients, including the various exercise protocols, hemodynamic responses, and the prognostic value of exercise parameters. This topic will shed light on the long-term cardiovascular fitness and exercise capability of individuals with coarctation. Hypertension commonly develops in adults with a history of coarctation repair and requires tailored management strategies. We will review the diagnostic criteria, pathophysiology, and treatment options for hypertension in this specific patient population. Additionally, we will highlight the importance of blood pressure control in preventing long-term complications such as aortic dilatation and cardiovascular events. Coarctation of the aorta often occurs in the context of genetic syndromes such as Turner syndrome, Marfan syndrome, and Schoen complex. We will discuss the underlying genetic abnormalities, clinical manifestations, and implications for clinical management. Understanding these associations is crucial for identifying high-risk patients, anticipating potential complications, and optimizing therapeutic approaches. Pregnancy creates unique hemodynamic demands that can be challenging for women with a history of coarctation repair. We will explore the hemodynamic changes during pregnancy, the impact on cardiovascular function, and the potential risks for both the mother and the developing fetus. Additionally, we will discuss the crucial role of preconception counseling, monitoring strategies, and multidisciplinary management in optimizing outcomes for these women and their babies. In conclusion, we have explored the complexities of coarctation of the aorta, including its development, diagnosis, treatment, and challenges. Early detection and personalized care are vital for positive outcomes. Thank you for joining on this educational journey.